who is going to be telling us how teleoptometry is going to be involved in the telemedicine and how the whole scenario of the eye care can be changed by new trends that he'll come in. So I'll introduce him again once he comes up. But before I begin, I would request Dr. Ashwini Goyal to please enlighten the audience with his remarks. Thank you so much, sir. Over to you, sir.
Thank you, Monica ji. I greet Dr. Natarajan, who is there, and thanks to Dr. Ahuja, Mr. Rajit Bharadwaj. So, well, good evening, ladies and gentlemen. I bring you greetings from the Telemedicine Society of India. And I'm especially thankful, as I said, to Mr. Bharadwaj for inviting me as a guest speaker. I'm greatly honored and humbled to be able to interact with the enlightened audience on this occasion. As we all know, it is all ophthalmologists here or people connected with ophthalmology. And we are in the business of correcting the great debility and disability caused by blindness. And blindness, as we all know, is not only a major disease, but a great social trauma, which affects an individual not only physically and emotionally, but also socially and economically. It's a major global problem. India was the first country in the world to launch the national program for control of blindness. However, there is still a huge burden of blindness in India. India suffers from a huge healthcare divide due to the shortage of doctors, with most concentrating their practice in the urban localities. Additionally, the inadequate infrastructure of roads, telecommunication, transport, and financial status of the patients makes it even more difficult to provide healthcare in the rural areas. So tele ophthalmology has come up as a new branch of telemedicine that offers solutions to this serious problem. At present, some advanced ophthalmology centers are engaged in tele ophthalmology projects like the renowned Shankar Nethralaya, Arvind Eye Hospital, and so many efforts which are being driven by the dynamic personality of Professor Natarajan. These have proven successful both in rural and the urban primary and secondary healthcare centers. Teleophthalmology is an effective screening and a management tool for a range of acute and chronic ocular conditions. With improvement in image processing and better integration of patients' medical record, teleophthalmology is fast becoming a more accepted modality, all the more so in circumstances where social distancing is inflicted upon us, as we all know, has happened during the current pandemic, where the social distancing norms have been put in place. So recommendations and policies from the government and national health organizations, combined with social distancing, have led to exponential increase in the telemedicine use. Teleophthalmology has great potential to be integrated into ophthalmic care delivery. In the emergency room, teleophthalmology can be utilized to triage patients and diagnose common ophthalmic eye diseases. Ophthalmology practices can utilize real-time medicine to conduct many parts of an in-person exam. In cases where more complex diagnostic tools are warranted, a model incorporating telemedicine and focused in-person visits may still be beneficial. Innovative technologies emerging in the market allow for increased remote monitoring, screening, and management of adult and pediatric patients for common eye diseases. COVID-19 pandemic has created a demand for healthcare delivery that limits in-person examination and entails potential viral exposure. Teleophthalmology allows ophthalmologists to continue caring for patients while keeping patients and the physicians safe. Although challenges still exist, the pandemic has accelerated the adoption of teleophthalmology. As a result, teleophthalmology will play an integral role in providing high quality, efficient care in the near future. And to this end, Teleophthalmology Society of India has an onerous mandate to bridge the existing healthcare divide in the country as far as ophthalmology is concerned. To achieve this, I wish to recommend to this August Assembly to focus on three aspects of healthcare delivery: to develop standards, protocols, and SOPs for provision of ophthalmic care, to ensure capacity building of healthcare workforce, both doctors and allied healthcare professionals, including innovative and entrepreneurial activities in teleophthalmology. And lastly, to train care providers in the practice of technology-enabled healthcare. And a great number of the optometrists, as we were talking a little while earlier, this great pool is available to us to enhance the workforce as far as ophthalmology is concerned. Dedicated and focused training of this humongous numbers of ophthalmology workers can create wonders. As you all know, this is very much in alignment with the avowed aim of the Telemedicine Society of India to promote and encourage development, advancement, and research in telemedicine technology and its associated fields. Being a not-for-profit scientific society dedicated to creating awareness of telemedicine at national level and carrying out scientific activities to promote telemedicine, TSI is recognized by the Government of India as a lead organization promoting telehealth in India. TSI aims to establish a pan-India telehealth network to facilitate delivery of healthcare by online teleconsultations. It is heartening indeed to see that the current president of the Ophthalmology Society of India and the president of Tele-Ophthalmology Society, Padma Shri Dr. Natarajan, is also present today in this forum. And we look forward to his pearls of wisdom a little later. I look forward to many ophthalmologists becoming members of TSI and TOSI as well. It may be pertinent to mention that Dr. S.S. Badrinath, as I was telling some people a little while earlier, the doyen of ophthalmology and founder of Shankar Netralaya, is also a founder and the first president of Telemedicine Society of India. As the president of TSI, I wish the organizers all success in their endeavors to promote the practice of teleophthalmology. I assure you that TSI as an umbrella body will extend all possible guidance and the required support to all those who profess to practice teleophthalmology in India. Heartiest congratulations once again. Jai Hind.
Thank you so much for those encouraging words, sir. I think we all are excited with the incentives that you have given and the need of the hour. As you had said, we all need to be involved. And I would say, yes, whatever we studied, the education pattern is also going to change. We all need to update ourselves, whether it is a fresh student who's passing out or me who's been here for almost 3 decades. All of us have to begin or unlearn what we have done and come back to a new stage. I think your words, which encourage us to come into a new future, be grateful for it. Thank you again for coming in. And in our team today, yes, we forgot to introduce Dr. Subudhi, who is one of the Tele Ophthalmology Society of India General Secretary. I welcome him also, and I request everybody to convey a big regards to him too. Thank you so much. Now I would request Dr. Natarajan to please tell us, yes, we heard tele-ophthalmology, telemedicine societies. Where is tele-ophthalmology heading to? And how does tele-ophthalmology see this come into the picture? Over to you, Dr. Natarajan.
Thank you, Monica, and thank you, Ajit, for asking me to be here. I'll share my screen. Oh, I have the, you would allow me to share my screen? No, still disabled. Yes. You can see my screen? You are muted, Monica.
Yes, yes,
Sorry,
doctor.
we can
Yes,
see
you can
your,
see.
yes, we
Oh,
can
Yes, doctor, you can see us.
I'm just opening there. So at the outset, I would like to thank thank Ajit and Monica for having me, and Dr. Ahuja also. And I wanted to recognize my brother Shenbagaraman. He's there in the. I saw him just logged in, and I don't know whether you can say hello, Shenbagaraman. And he's an optometrist, and he's actually a class fellow of Jyoti Dave from, and also Lal Dave, who are practicing for more than 40 years, I think. And my brother also is practicing contact lens when I was probably in the medical college. So with this, I think I chose a topic of co-management by ophthalmologists and optometrists in India for eye care using the tele-eye health care services. So the tele-ophthalmology is a branch of telemedicine that delivers eye care through the various equipment with using the telecommunication technology. And I want to make sure that the ophthalmologist along with optometrists can do all of this, which is mentioned here. And tele-ophthalmology practice in India from beginning, Shankar Netralaya, our Aditya Jyoti Hospital, Mumbai, Arvind Eye Care, Madurai, Wellcare Health System, Chennai, Tripura, Tele-Ophthalmology Network, AIMS, New Delhi, Jipmer, L.V. Prasad, Narayan Netralaya. I've just given a few who are pioneers in tele-ophthalmology. I'm sure many more are doing that. And the objective of the tele-ophthalmology objective is like a service center, and so it's a service center, like you from actually this is a Shankaranathala Telehub where they are doing for other ophthalmic hospitals for second opinion through mobile van, continuous medical education, higher learning center, tele-monitor, mentored procedure surgery, and higher research organization, and also public awareness. So this is a Shankaranathala Tele Ophthalmology mobile unit with internet. They have inaugurated as early as 2003 in the 10th October. And I'm sure I remember Dr. Abdul Kalam as the president also came and inaugurated the expanded the program. And providing urban facilities to the rural area through mobile ophthalmology unit, comprehensive eye examination in rural area at the patient's doorstep with spectacle dispensing, diabetic retinopathy screening camps, eye screening for school children, and awareness on eye ailments in rural areas for the public. This is again a mobile refraction van. They only had a refraction to be done in the van. And these are the 2003 to 2020. They've done about 3,000 camps, and total number of patients examined is about 6 lakh people who benefited from this. And the Arvind Care System, managed by Dr. Kim, Dr. Nampar Malsami, they have a vision center for every 50,000 population, permanent low-cost eye care facility to reach the unreached, aim to provide primary eye care and referral services, manned by a trained technician and linked to base hospital with wide bandwidth, more than 7,36,414 teleconsultations they have done. And this is how they do with the registration, the vision center process, the data being sent back and forth, and I have seen this happening there. And Tripura Vision Center project, where it comes under the Ministry of Health and Family Welfare, again have eye care service to the previously unreached rural citizen, Department of Health, Government of Tripura, and ILFS and ETS with the help from Arvind Eye Care. The Vision Center database server is located in the Indira Gandhi Memorial Hospital premise at Agartala, the state capital. The project serves a rural population size of 27.18 lakh in the remote areas, covering 45 blocks in 8 districts in state of Tripura with 40 vision centers. Similar things should be done by every state. And the other example is the L.V. Prasad Eye Institute. They have the pyramidal model of eye care. They have the community, primary, secondary, tertiary, and advanced tertiary. And AIMS have video consults clinic for all departments launched on 14th November 2016. And during this Corona, I think they are discouraging normal OPD patients to come. They are using telemedicine for treating patients. The other business model, WellCare Health System, my friend Dr. T. Senthil, who's an ophthalmologist, but an entrepreneur with a private preventing blindness through affordable telemedicine technology system, which is a very successful businessman too, but using the private practitioners to do it. But everywhere I see it is an ophthalmologist who's running it and not directly with optometrist or any paramedical. And the other is an innovative diabetic retinopathy care model, where equipment deployed in a diabetes hospital, then using the software, OPD screened by technician, nurse, and images uploaded to Forest Cloud server. This is done by the Forest. I don't have any financial interest. Images viewed remotely by ophthalmologists, and final fund of the report is sent back to the person who's operating the system. And I think Karnataka Internet-Assisted Diagnosis of Retinopathy of Prematurity, the KidROP, Dr. Anand Vinekar from Narayan Netralaya. It is based on the Triple T philosophy, Tele-ROP, training of peripheral ophthalmologists and ophthalmic assistants, and talking to neonatologists, pediatricians, and gynecologists. And KidROP has trained technicians to screen infants in peripheral center, and RetCam shuttle and store, read, analyze, grade, and upload these images from the rural center. It's all using an indigenously developed internet-based PSCS system, which allows delivers through these images live to the remote expert on his or her iPhone or PC or iPad, and receives live report delivered to the internet-based server for the technician to read and provide. If you see here, everywhere, the role of the technician or optometrist is there. So the role of an optometrist as a future leader, and that's my point here. I'm an ophthalmologist. My brother is an optometrist. My father was a renowned eye surgeon, and as well as the head of the first cataract camp started by the then Chief Minister Karunanidhi in 1972. When both me and my brother were in school, we were writing notes as volunteer, and we know the importance of optometry, and we know the role of me as a vitreoretinal surgeon, the role of optometrist, and me as my father as an ophthalmologist. He's no more, and my grandfather. They both were experts in refraction, and that too they mastered the Duke Elder's book on refraction. And I always used to hate it because it was so many questions they'll ask me, and as an ophthalmologist I used to fail answering. But I'm glad I have a team of optometry in my hospital and my foundation in Dharavi, as well as I have an optometry school, fortunately recognized by Maharashtra University of Health Sciences, thanks to Dr. T.P. Lahane, the Director of Medical Education and Research, who has renewed our license to start the optometry college, which we are starting shortly now. And this is according to me, optometrist is and will be the first point of contact with patient, whether it's UK or US, where they practice independently. And here we have people like Ajit Bharajwaj and Monica, where they are practicing, and people are like in my hospital, they're attached. And the first point of contact is optometrist. And then having expertise in diagnosing, our Aditya Jyoti Hospital is ably managed by a team of optometrists during the COVID crisis, and either before or after, early detection and preventive care, advising patient to seek timely intervention from ophthalmologists, and education the patient on the health of their eye. So the symbiotic relationship, the only forward, here we have the Zeiss optical company and franchise-based model for teleoptometry, webinars and corporate events, and we have to leverage all this. So ophthalmologist and optometrist working in partnership, patient visits optometrist, optometrist diagnoses about the patient, optometrist provides opinion, diagnosis results shared with patient referred to consultant ophthalmologist. Here, I made a little change, which I'm trying to work with all the optometrists, one through Ajit Bharajwaj and Mr. Oli in Bombay, and also Tanuja in Botswana, saying that instead of them referring, why not you have a franchise model either from Aditya Jyoti or any eye hospital, where like Aditya Jyoti eye hospital takes responsibility. Maybe if Ajit takes as one of the as a partner optometrist, where he'll be a Aditya Jyoti franchise optometry center, where he will examine a patient in Delhi, send the images to the ophthalmologist in Aditya Jyot, and Aditya Jyot here, instead of conducting the diagnosis through tele-ophthalmology, we'll conduct it through the optometry. And this is my change, which is what I want, and I hope it will work, because it will be a win-win. The patient pays for the professional time of optometrist, and the optometrist pays, collects total and pays the any eye hospital, maybe Aditya Jyot or any hospital, the professional time for the ophthalmologist. And finally, the solution provided to patient as a one-stop shop, so that the patient need not run around. For example, the Aditya Jyot diagnosis, because the patient, I don't remember where Ajit is practicing. For example, I can take it as he's practicing near India Gate, and then he may find an eye doctor who's willing to take the advice of either Aditya Jyot Hospital or himself, and takes care and treats the patient nearby, and which is what we want. And then they also charge. And similarly, even charity can be done, where we are doing free treatment in Dharavi. Same thing can be done in the slums of Delhi, XYZ, where. So finally, it's a win-win situation for all the stakeholders, finally keeping patient in mind. And I'm sure all optometrists are governed by their own whatever moral laws, which I think Elite School of Optometry is providing, the various optometry schools providing that they will be trained to use all gadgets.
Natarajan, I think you went on mute. Sorry.
Can we hear sir now?
No.
Boss, you're muted. Dr. Natarajan, you're muted.
So Dr. Natarajan's muted, right?
You're muted.
Oh, sorry. Maybe
Yeah.
I think Monica.
No, the last, just the last last slide, sir.
Okay, I will. Okay, so this is the, I already spread that. Okay, the application of the telemedicine by optometrists, where we use ERG, consultation of patient for low vision aid, referring ophthalmologist for checking retina, all can be done by telemedicine, by teleoptometry. And here you can see the handheld device for refraction with the stand, with stand, and then smartphone-based retina imaging. And you see here the one with the Forus, sorry, why is it? This is Avero with the chin rest, laptop to the left for the operator, here with the Forus camera. And then you have I introduced this nationwide diabetic retinopathy screening as a AOS program called Jyot Se Jyot Jalao. And this was I've done as the president all over. This is one of the program in Jharkhand, where the minister and the chief minister was there, the health minister. We did in Kumbh Mela, and all this pre-COVID. We have a All India Ophthalmic Society National Committee for Diabetic Retinopathy and Awareness and Screening. This is one of the program by Dr. Jignesh Chaswala, Vice President of Maharashtra Ophthalmic Society. We did and then these are the various camps. You can see almost through Remedio, they have screened about 4 million people, Forus about 3.8 million people, Artiles about 72,000, Zeiss about that time, it was the beginning of that, and then Cipla about 7,255. And so finally, we also have a diabetes clinic at Aditya Jyot using teleophthalmology. We have Dr. Kiran Shah, who can give the medicine where the patient can pay and get that. And here, the main thing is about diabetic patients who are not getting out because of the comorbidity, and they're not able to take care of them. And now we have this new problem, mucormycosis with the diabetes. So with the corona, so I think all this can be done by teleophthalmology. And instead of patient coming from far away to another clinic far away just because they are attached, they can go to the nearby clinic. And I think the shared care will be the modus operandi, which will be helpful. And this is again the field level for doing a camps, and which we can do it with the limited people, like pre-screening awareness, assembly of diabetics, capturing of image and diagnosis by the ophthalmologist, or using the offline AI, which we are doing. And we can also use the posterior segment diseases. The diabetic retinopathy is preventable blind. And the other condition, when you take a photograph of the retina, you can see age-related macular degeneration, hereditary macular degeneration, or any other retinal problem. And 77 million have diabetic. And the International Diabetes says that the prevalence of DR is about, diabetic retinopathy in diabetics is about 21.7%, published in IGO in 2014. The main problem is lack of awareness of the disease. fairly long asymptomatic stage, and visual impairment occur when diabetic macular edema or proliferative diabetic retinopathy sets in. The selection of screening device, it should be a portable, low maintenance, accessible in lack of power supply, internet connectivity issues, uploading images on cloud data security, ease of data sharing among primary, secondary, and tertiary centers. So this is the remedy on fundus. Again, I don't have any financial interest. I showed Forus, I showed Zeiss. It can be mounted on a suitable bike for a transporting for a purpose, and then also it can be charged. And then the selection of the screening device, it should be having a gradability of images with a good specificity and sensitivity. This is on a fundus on phone and Zeiss, between comparison between the Remedio and the Zeiss. And the main problem is we have only 1 out of 100,000 ratio for ophthalmologists, and we need about 45,000 optometrists. I don't know how many optometrists are there, which probably Monica should answer. And there are about it's vital that optometrists take charge of primary eye care and skilled workers taking charge of screening, so that we increase job opportunity and the eye doctors can concentrate on confirming the diagnosis and treatment rather than doing the screening as well as diagnosing. And here you see Mr. Manish, who's an optometrist, who's using the Zeiss camera, VisuCam, inside the van, which we got it from the World Diabetic Foundation. And also we are using the first in the world to use a motorbike for screening for diabetic retinopathy. And this is a van which was inaugurated by Dr. Abdul Kalam. There's inside the van, we have all the equipment. We have Mr. D. Shivanandan, who's was a trustee, and now he supports my eye care. And this is a motorbike inauguration done by my grandmother, who was almost 100 years, which was the first in the world that time. 1st March 2014 it was done. You see Mr. Shivanandan, Mr. Ravichandran, and my father, late Dr. N. Sundaram there. And this is again Mr. Zoheb, the optometrist, who's teaching me to use the handheld camera, which is Optomed from Finland, where it connected to the internet. We go door to door and do the screening, and the social workers are there. So this is a small 1 feet lane between the two houses in Dharavi. So I think this way optometrists and ophthalmologists can work together. So the ease of this just show the easy retrieval of data, uploading of diagnosis by the regular specialist, treatment and general advice, and regular interval visits can be done by the optometrist. So the expected outcome is early detection and treatment after screening can reduce the prevalence of diabetic retinopathy even in the remote areas, reduction in economic burden among poor and illiterate people, opportunity for a non-skilled worker to be a semi-skilled worker, and it will help to improve overall health of the population. So financial model for the government, the cost of setting telemedicine, cost of device, cost of transport, cost of manpower, cost of treatment provided, maintenance cost about 10 lakhs a year, which can come down if you can do a mass. So I want every optometrist to take this program, either do it a charity or do it as a chargeable. And I request our leadership development program alumni of All India, Rotary, Lion, Indian Medical Association, Government of India, state government to take part in it. And specifically in this platform, all the optometrists. So we are generations of ophthalmologists. My grandfather, late Dr. Nataraja Pillai, my father, Dr. N. Sundaram, my brother, Shanbhagraman, who are optometrists, and myself, and my brother is in Chennai, and myself in Mumbai. So I thank my father, mother, my guru, Dr. Badrinath, who happens to be the founding president of Tele Medicine Society of India, and I'm the founding president of Tele Ophthalmic Society of India. And thank my friend, Mr. Shivanandan, the DG Police retired from Maharashtra, and finally the God. So I always quote my inspiration: arise, awake, and stop not till the goal is reached. So the goal here is, one of the program which the Tele Ophthalmic Society can do is to prevent diabetic blindness. What about other problems? So we have a low vision age. 52 million people have a low vision. So why not we do that through Tele Ophthalmology, teleoptometry? Also do refraction. There are programs like PEAK in Africa, designed by a eye doctor from London, working in Africa. And then so I take this opportunity to thank all of you for a patient listening, and I'll be happy to answer any questions, because I had requested Ajit that I have I'm addressing a national program by Echo India on COVID. And my only thing is to say, Monica started by saying a lot of people are affected. I am personally affected. Our current president of Ocular Trauma Society of India, Dr. G. Mukherjee, the president of Eye Bank Association of India, passed away yesterday in Delhi. It's really sad. So I should conclude my talk, which I should have done in the beginning, with keeping a few seconds silence to pay respect to the soul departed. But at the same time, I think he was a man of action. He was only dedicated his life for prevention of blindness due to trauma. And also he was a cornea surgeon, again, corneal blindness. So I request everybody to be silent for a few seconds to may his soul rest in peace.
All of us to remain silent for some seconds. Thank you so much. We really pray that everybody is safe and healthy. It's really very sad, and many families are under.
No, Monica, I wanted to remove the word sad because I know it's definitely sad because physically we lost people. Unfortunately, every day for last 5 days, one eye doctor is dying. And I'm really, I won't say sad, but I think whatever, it's karma. We can't be, birth and death are decided by him. So only thing I want to say is all of us should remain safe, stay healthy, stay happy. The reason I'm using the word stay happy is to increase the happy hormone to all of us to be protected against this dreaded corona. And I'm sure 60 plus will have comorbidity, so we should not attract sadness. So even though the souls are departed, I only pray Lord Krishna for them to be having peace. And same time, I know that I'm internally having this problem. And Ramana Maharishi, 2 days before his death, said to the people, hey, why you people are crying? I know I'm going to be here. Who's going? Only this body is going. Only the body is perishable, not the soul. So all the souls are there. And even though the eye doctors are dying, who physically cannot treat people. So with this, I want to say, in spite of, I concluded my talk with a sad note, but I want to be all of you to be happy. I'm sure Dr. Mukherjee from the heaven is blessing me because I handed over president of Tele Trauma Society to him, and he is still the president. We have to call for the meeting, even though he's passed away. We have to give it to Dr. A.K. Grover, who will be taking over. So with this, I request any questions or any criticism, both I like to take.
Yes, sir. Dr. Hitendra, and I would request Dr. Subudhi to please thank, or I would say comment on sir's presentation.
Thank you, Ms. Monica. It is a wonderful address by Dr. Natarajan. He is my president. I would say that our president of TOSI, and I'm the general secretary of TOSI. And we like to associate with the Tele Ophthalmology, as you said. Even I was in contact with Mr. Ajit Bhardwaj. So probably the time will come where coordinated effort is required, not only from Tele Ophthalmology, so all the branches of telemedicine. We have to coordinate to work for the prevention of blindness. So all sorts of blindness you have to take care. And Dr. Natarajan has a very high vision for TOSI, or Tele Ophthalmology Society. And we wish, so by 2025, if not we make blindness free India, at least can reduce the blindness at least 50 to 60%, then that our achievement will be very high at that time. So thank you very much, Dr. Natarajan. You have given the really wonderful speech from Tele Ophthalmology Society of India. And really, I want to thank also Mr. Ajit inviting me to say a few words. Also, thank you, Dr. Mrs. Monica. Give me an opportunity to speak a few words in this forum. Thank you.
Thank you so much. I think the future is very bright when it is in hands of people like you. Sir, you would like to say something?
No. I only wanted to say, I saw my brother Shenbagaraman is on the line. I don't know whether you know him. Ajit knows him. So he's on the line. Maybe he can talk.
I'll request him to come forward.
Yeah, so he is a optometrist qualified from both India and London School of Optometry.
I have given him the right to unmute, sir. He can please unmute and speak a few words.
Thank you, Monica. Thank you, Ajit. And I thank my brother, Dr. Natarajan. He's my Mata Pita Guru now after my father's demise. Can you hear me? Hello?
Yes, we can hear you. We can hear you.
Yeah. So basically, I think for the past 3 days, I sent a note in the association as well as to Dr. Natarajan in text messages that we should have a practical demonstration on this tele optometry, so that anybody in the remote villages should learn immediately and practice from tomorrow. And Ajit Bharadwaj has given Ajit, are you there, Ajit? Hello? Ajit?
He's there. He's muted. He's
Yeah,
there.
Ajit has given me a statement today that that we'll have a practice system tomorrow by some systems, so that they are given a particular WhatsApp number from tomorrow morning, so that anybody can see this and tomorrow they can practice teleoptometry through Tele Ophthalmology Society of India, whatever we call. And so that the number of optometrists still is unknown, and I'm trying to get data from Lakshmi Shinde, Aditya Goyal, Ajit Bharadwaj, Rajesh Vadwa, and whom all I know in this optometrist, is Monica Chaudhary also. And Jyoti also says she will help us now to have a joint effort rather than the names of associations. We will associate well as optometrists of India, that's all. And we like to collaborate and with the ophthalmologists, as Dr. Natarajan said, any hospital you like, join immediately with any institute or a particular state or a particular town immediately through all the associations. And they can start this optometry as a new venture, virtual way of doing, and also a win-win situation for the optometrists, and the opticians also can join hands to eradicate blindness, as he said, stop blindness. Not wait until 2025. If we can take efforts by 2022, we can do at least about 50% of the problems what we're facing now. Thank you very much for all who are present here, who are giving an opportunity and talk, and more unity with all opticians, optometrists, and ophthalmologists in India to be a proud people of the world, proud vision care people. That's what I wanted. Hello, yeah.
Yeah, thank you so much.
Thank you. Sorry if I've spoken more.
No, it is, every word is meaningful, sir. Every word.
Much. Thank you.
Thank you so much. Thank you. And I think you're really the representation that you want to bring in. Thank you so much.
I will coordinate to have a complete team with you, with Monica and Ajit, not a problem.
Thank you so much. Thank
Dr.
you.
Hitendra Ahuja, you want to say something?
Yes, I would like to invite Dr. Hitendra now to actually brief us what AEDI hospital has been doing so far in telehealth, and they have recently entered into it.
I think again you have to mute everybody, Monica. Monica, you have to mute.
I've done that, but I think
Yasir student, I think is not there. He's talking to somebody. Yasir student. Dr. Ahuja.
Yeah, sir. Good evening.
Only thing is, after you speaks few words, I want permission because I have to already log into that my 6 o'clock. I'm the only speaker there. 6
sure,
to 7.
Sure. Good evening to all. Respected Dr. Ashwini Goyal, Professor Natarajan, for taking out time to enlighten us on this topic of telemedicine and teleophthalmology. And special thanks to Professor Monica for organizing this, which is very much need of the hour. We all understand that we have discussed there is a huge number of preventable blindness that we have to deal with. And now with the COVID crisis for 2 years, the burden has swollen. The per capita income in the urban and rural India has been affected. According to the data in India, there are 9 ophthalmologists for every million people. So seeing all this, it makes all sense to bring this telemedicine and teleophthalmology to our armamentarium. we have tried all these years, the government, the private sector, everybody has tried. The doctor cannot reach villages. It is proved over time, but technology can reach everywhere. And rural India now uses smartphones, and that tells us the speed of internet is no longer a hindrance. And there is no doubt that our cause should not work. And if I think there is a issue of awareness, and if proper awareness is created amongst professional patients, this technology can be scaled up. We at Ahuja Eye and Dental Institutes are running 7 vision centers pre-COVID, and used to take care of around 30,000 beneficiaries per year. But this emergency has brought everything to a halt. But we don't intend to stop here. We plan to start fresh with 20 vision centers once this storm settle down, and with Tele Ophthalmology being incorporated in all vision centers to take care of various ophthalmic diseases. The advantages of teleconsultation, teleophthalmology are it has extensive outreach, as we have discussed, timely intervention for emergency like chemical injuries and trauma, and avoiding unnecessary referrals at the tertiary centers, and that saves a lot of cost and time and effort of the patient as well as the doctor. And yes, health and education, basically we can educate the rural and the people who cannot reach these centers for eye donation. And we all know that there is a dismal between the what we need, the corneas we need, and the requirement. And I think I'll not stand between audience and Dr. And Mr. Ajit Bhardwaj, who will tell us about the latest trends in ophthalmology. Thank you once again, Dr. Natarajan and Dr. Goel, for being with us and sparing your valuable time. Thank you.
Thank you so much. I think, sir, yes, this is the initiative, and Ahuja Hospital has always been leading and supporting optometry, and we've been able to make up this. I think future we will be able to drive much more outcomes out of it. Thank you so much. I would like to invite Ajit Bhardwaj now. Sir, you can unmute your mic. And to introduce him, yes, we all know him as a renowned optometrist in India who has graduated from AIMS in 1979. He's completed his master's from Masters of Optometry and is the founder and director of Optique in Vasant Vihar, New Delhi. He has been the past president of Asia Pacific Council of Optometry and Indian Optometry Federation. He was the board member of World Council of Optometry, World Optometry Foundation, and Optometry Council of India. He has also been the clinical director of Special Olympics Opening Eyes. Over to you, Mr. Ajit. And I would request that if you could be more crisp in making us understand how we can integrate these technologies into the whole system. And we would like to have the question answer session time more for us. So if you could explain the precise way we can integrate it. Over to you, Mr. Ajit.
Thank you, Monica, and thank you, Dr. Natarajan, Dr. Subudhi, and Colonel Goel for sparing your valuable time. I understand every one of you is very busy, but I must appreciate the kind words from TOSI President and Secretary, and I'm very pleased that the welcome TOSI has given to optometrists we have not received from any other ophthalmology society in the past. So we must compliment their openness.
Ajit,
yes, sir.
I'm going to leave in a second.
Yes,
but I
sir.
wanted to say, as a president of TOSI, thanks to Dr. Subudhi and the entire
yes,
executive committee, as well as the immediate past president of, I'm still part of the governing council of All India Ophthalmic Society, our support, because it is symbiosis, as I put it in my slide, and I mean it, we have to work together. Only whatever delineation which is there, we will work. And if you remember, last 1 year we are doing program. Now we have to do action. So with this, I have to leave. I have carry on. And Dr. Subudhi is the elder to me. He will represent me.
Thank you, sir.
Thank you. Thank you, boss.
Thank you, Monica, and thank you, Dr. Ahuja, for inviting me for this talk. I appreciate really your openness and your kind invitation. You know, my talk is not on what we are doing, but my talk is on what are the trends, what are the global trends in ophthalmology and optometry. And so I'll be focusing on what are the international practices, how they are doing and what we are doing, and how we can cope up with the rest of the world in reaching to the population. The basic concept of the talk is on latest technology. If we talk of technology, we have seen that technology keeps on changing every time, since times immemorial. And but if you look at last 1.5 years, the way we have adopted new technologies and new innovation, it's something very, very unique. I'm talking of in variety of ways, and I'm talking of in numbers. The way we teach, the way we learn, the way we attend conferences, the way we do our yoga, the way we celebrate, the way we conduct our obituaries, everything is changed. And that has happened only in last 1.5 years. This has impacted a healthcare delivery and healthcare workforce to a very great extent. And if you look at ophthalmology, we are one of the specialty whereby we are closest to the patient. Our number of patients are second highest in all health care facilities. We attend maximum number 2 patients after the orthopedics, and we have very close proximity with the patients. And looking at that, we have to see what we heard today, that one ophthalmologist died in last 5 days. And I was listening to NDTV news yesterday that in last 1.5 years, IMA has lost 1,056 doctors. So that suggests is not only the need of the patient, it is the doctor's need and doctor's requisite that our ophthalmologist or optometrist or frontline health workers, our emergency workers are safe. And that is the need. The telemedicine as such is on rise. And when I look at our field, I have to look at what is happening in the rest of the field. If you look at the companies like Practo and LifeDate, these are the 2 companies in telemedicine. They have 2 lakhs of doctors registered with them. LifeDate has 80,000 doctors. LifeDate has 80,000 doctors registered with them. That suggests that the need for telemedicine has risen very sharply in last 1.5 years. And this is going to increase. Only thing is this, that we don't ask our patients. We only feel that, yes, our patient may not need our services by telemedicine or tele-ophthalmology practices, but that is not correct. If you look at the studies and surveys, most of the patients, including me, if I have a choice, I would like to stay and take a medical consultation at home rather than going and standing in a line or standing in the queue with a physician or any other specialty. That suggests that telemedicine practice will be on rise in time to come. And
Sorry, Ajit sir.
You're muted.
You have to, I unmuted the others, and I'm sorry.
Okay.
Sorry.
So look at industries like Tata Health, look at industries like Amazon Care in US. They extended healthcare facilities to all their employees, to all the 50 states. Look at Tata Health providing telemedicine services to patients as low as starting 400 rupees for a physician's consultation. That suggests that we have to adopt ways and we have to change the ways that we have been practicing in past. Understanding last year, 23rd of March 2020, we had this telemedicine laws, and most of the credit goes to Colonel Ashwini Goel and Telemedicine Society for bringing out these laws. And looking at, there are 2 kinds of consultation happening in telemedicine. One is asynchronous and other is synchronous. Giving you a brief about the 2 consultations. Asynchronous is a kind of consultations whereby you can store your data and you can send it to your doctor. It means that it is not a simultaneous consultations with your doctor. And patient